88.7 FM KAZI. Good morning, y'all. It is 8:30. This is a little something we call the morning grind. Your boy Jabari Warfield in the building, as well as Terrance. Terry?
Yes.
From Grown Man Game Radio. And when does your show come on, sir?
Wednesday is wonderful, bringing fun back to what it means to be a man. Mm-hmm. Go be depressed someplace else. Go be mad someplace else.
Go be mad at someplace or somebody else?
Right.
Go be mad at KAZI.
Yeah, what you got going on today, man?
A little later on, man, I am doing that smooth jazz, baby.
Jazz.
Yes, sir. 7 to 10 tonight. It's Jazz and Other Vibes, smooth jazz and R&B from today and back in the day. And tonight, I get the honor and the privilege and the pleasure to debut a brand new song from HTU Director of Jazz Studies, Dr. Jeremy George.
Oh, wow.
Yes, sir. He has a song called Hard Boppin'. He sent that to me, I think it was emailed to me yesterday. It's his new single, and Jeremy's bad boy.
Okay.
Bad boy. Real talented. Great bass player. He's also an educator, band leader. And he sent me his new song, Hard Boppin' from Jeremy George. Is going to make its debut tonight on my show on Jazz and Other Vibes from 7 to 10. So be sure to tune in for that. And, of course, I got other great music. Show's 3 hours long, 7 to 10, so join me for that. So I am really, really glad to have these folks in our building. And I tell you what, this is something that I'm gonna keep it 100. You know, checking on your health is it's necessary, but it's also a scary thing.
Yes.
You know what I'm saying? Especially for guys.
Yes.
You know, women are like, I got something wrong with me. I got to go checked out. Guys are always like, well, as long as I can walk, I'll be all right. You know? But we've got Dr. Larry from Black Men's Health Clinic in the building, and we are going to talk to him about, I believe, some awards just won and what Black Men's Health Clinic is about. I'm looking at the website right now. You can follow along, blackmenshealthclinic.org. Dr. Larry, good morning, sir. How are you?
Good morning. Thank you for having us.
Yes, sir. Thank you for being on. I certainly appreciate it. So for those people who don't know what Black Men's Health Clinic is, please tell us.
The Black Men's Health Clinic was launched almost 5 years ago, and the reason we launched the Black Men's Health Clinic was because we knew and recognized that black men have the highest rates of health disparities among anybody else. And with that, we seem to have the least access to health care. And a lot of that is a decision that we make. So the Black Men's Health Clinic was really created to remove those barriers that prevent men of color from accessing health care.
Yeah, and there's a lot of stigmas that go along with that too. I think sometimes we talk about, like, sometimes the food we eat or us not working out enough and things of that nature. Is it mainly just about health, or do you guys talk about exercise and other ways to change your day-to-day in terms of that, in terms of living longer?
Yeah, our 3 pillars that we created, it's a holistic approach. And health goes beyond just going to see a doctor. It really is. It's what you eat. It's if you exercise, do you do the things to really take care of yourself. Our 3 pillars are physical health, mental health, and social determinants of health. All 3 of those have a huge impact on the health status of black men.
Awesome. Very cool. Now, I know somebody out there saying, well, why a clinic for just black men? Why can't you just do a clinic for all men? There are already clinics for all men. Talk about why black men specifically. You touched on it just for a second, but talk about why black men specifically.
What I realized after leaving corporate, after 40 years of healthcare administration, there's a lot of services that are in the community, and you've already touched it. Women's services are covered, and we appreciate that. But when you talk about services for black men, and keep in mind, we see all men. We don't discriminate. Matter of fact, almost 40% of the clients that we serve are Latino men. So even though it's called Black Men's Health Clinic, we don't turn anybody away. But the reason we focus on black men and the reason this was all done in the beginning was because we recognized the state of black men. And coming out of COVID after the murder of George Floyd, it was like, you know, we got to do something. I mean, we talk about it, and it really revealed the status of men as it relates to stress. Our brothers have been beat down, knocked down, and as a result, we're reluctant to even try to access care. And so what we do is we have a very different approach to how we do our services. There are many clinics in town, but when you see how many black and brown men actually go to those clinics, it's a very small percentage.
Wow.
And there's a reason for that.
Well, let's talk about the services you do provide.
The services that we do provide, as I said earlier, we have 3 pillars of physical health. We're blessed to have an African American doctor in our clinic.
Yes.
Before we got started, we surveyed over 700 men and said, how come you don't go to the doctor? And my brother right here talked about some of that. I'm scared because I know they're going to find something wrong with me. And a lot of men don't go to the doctor because of what I call institutional racism. It's how you're treated. It's real.
Yes.
It's real. And so anybody who wants to think that that's not a factor, it is. But when we talk to men, there were several reasons why guys say, I don't go to the doctor. 1, I need to see somebody that look like me. Number 2, I don't have the money. Number 3, I can't get there. Number 4, I got a job and I can't get off work. And a lot of it was just simply fear. And so our programs really address each of those areas.
Well, yeah, fear is a big thing because you don't want to get bad news.
Right.
Having bad news is one of the toughest things that you had to face. I remember the day that the doctor came and told me and my sister in the emergency room that my mama wasn't going to make it. And that hit me like a sledgehammer. I've never had anything hit me that hard. So I can understand when people come to you and they say, here's the challenge that you're going to face. A lot of us don't want to hear that.
No.
But we have to. But a lot of us are like, man, we can go out and play football with the boys, you know what I'm saying? We can go out and drink and go out and do whatever we want to do. But, man, getting that news has got to be really tough, especially for brothers.
It is.
Especially for brothers.
And in the interest of full disclosure, no one here knows this. I go to the Black Men's Health Clinic. Shout out to Dr. Jenkins.
Hey.
So I'm just saying, like, I'm not only I'm a client.
Not a client. You can play president.
Yeah, I'm not the president. I'm not just the president, but I am. So, and no one here knew that. But yeah, I go. And I had a lot of the concerns and all of that stuff. Like, man, I don't want to tell no white man, you know what I'm saying? But I walked in like, man, everybody here black, and it's just a vibe, and the great services. They're professional. They know what they're doing. You feel really comfortable and you feel really relaxed, and that's important. The same way, white people go to a white college and they feel relaxed and comfortable around their people. If you a black person go to a white college, you still get the education, you still get everything you need, but that comfort level, that experience.
Yeah,
so
experience.
Yeah, I can attest to it. And anything you need me to attest to, I can attest to. Health insurance, they'll hook it up if it's possible. They do haircuts over there.
Oh, come on, really?
Yeah.
Okay,
Yes.
wait a minute. Now, see, I need the hookup. You see, I need the hookup.
Right.
I need the hookup.
Right. And black men, trust me. If you come up and because you can keep pushing stuff off. You can keep putting it off. Like, man, listen, I'm only bleeding out my elbow. It's gonna go away. And 6 years later, I think it's going away. I think this, So yeah, if you, I totally understand, and there's a lot of valid reasons why, guys don't want to go, and fear is a major one, but they will put you at ease because they all understand. I think we have a call.
Yeah, I think so. If you guys can take a call, hopefully this it'll be. I think everything should work out. Good morning, caller. How you doing?
Good morning, and I'm glad I'm tuning in. I haven't actually listened to KAZI in a while, and I'm glad that I finally got off my radio as far as doing the internet thing, and I'm doing something locally again as I used to do. And I'm glad that you all are the guests for today. But I wanted to ask, would you say some of the stigma of black men not going to the doctors due to lack of knowledge, knowing, because a lot of them have, let's say they have jobs and they have benefits, and they just fail to exercise those rights as it relates to their benefits.
That's good.
Like, or those, most of them don't go because they don't have a job that has benefits. But what would you say? Would you say that's one of the stigmas? Question.
Absolutely. And let me say, what we do is establish trusted relationships with the men that we work with. Generally, our team, and we got a great staff of folks that really carry the weight for what we do. And we do things differently. And so we don't just have a clinic and say, the door is open, you come to us, right? We go to you, and we are in the community, and our folks are having conversations with men and trying to persuade them to take the step to come in and see the doctor. So the awareness is huge. Even though we've been doing this almost 5 years, there's still so many people that haven't heard of us. So I appreciate the opportunity to be here. And the thing that is really most impressive to me, I got a brother sitting next to me that's a client. And trust me, I can talk all day long about what we do, but you know who can say it better? It's the men that walk in our doors, receive the service, they're treated with dignity and respect, they receive what they need, and when they leave, guess what? We don't say good luck. We're going to follow up with you. We're going to keep up with you.
Follow up with you.
And make sure, if you have a referral, you're going to get to that referral. If you have a prescription issue, you call us. If you need a ride to the clinic,
they'll give you bus passes.
We will make sure you get to the clinic and get back home. But health education is huge. And my pastor at the church said we would do better if we knew better. And so to your point, yes, knowledge, information is a big part of this. Absolutely.
Well, thank you. I actually work for Austin Housing Authority, and we also have, we're always spreading out community awareness as far as resources. And I personally, whether it be business related as it relates to referring a resident to your services, I also refer people in the community that may approach me and say that they're, lack of, like, I need to get to the doctor, I need to do this. I was like, go over there to Elaine Loftonville. They got the Black Men's Health, like, they got so many things going up under that roof. Yeah. But I'm always constantly promoting you all. So good job, Black Health Clinic, and I'm looking forward to hearing more about you all in the community. I appreciate you all.
And I just want to say that we have a program called Know Your Numbers, and we do it really within the housing programs. And that's just another way to get out to connect with men. And as you heard earlier, if you knew better, you could do better. But you have to have a way to get that information. And so the health screenings that are available, and we work with Austin Public Health nurses. We don't do this work by ourselves. We have lots of partners. Right. And so because of that, we're able to reach into other organizations and agencies that provide services, and we're able to have a holistic approach.
Perfect. I know I'm going to, especially hearing you all now, I'm going to try to partner with one of my directors to see if we can get you all out to do maybe a health fair for our Black men, or men, period, as you stated. But, I do, as you stated, our focus is on the Black men's health, but we don't discriminate, correct?
That is correct. Absolutely.
Thank you, sir. And y'all take care.
Thanks for calling in. Appreciate it.
And we are connected with the Housing Authority. Just wanted you to know that.
Yes, I know you are. Yes, I know. Thanks.
Okay. Thank you.
Bye-bye.
Thank you.
And in addition to that program, what other programs do y'all have, that y'all got coming up or that you want the people to know about?
I think the Know Your Numbers program, as well as the program that Kianis is overseeing.
What program is that? What's that called?
Movement is Medicine.
Okay.
Yeah, I saw that.
That is a real important program because, and especially as you get older, if you don't move, then things are going to be again happening with your body. And so I think that the movement and medicine program is a huge force. The cancer awareness that we've already talked about, we're associated with Dale Medical School on those programs. We also have health education programs. And as I said, we connect with so many of our partners around mental health and other services. So this Saturday, quite honestly, at Mount Zion, Keanis and the movement in medicine will be there at 9 o'clock. He rotates to different churches, and the whole purpose there is so that we can reach as many people as we can. I attend those classes when I can, and it's a good workout, and I realize how bad a shape I'm in. quite honestly, I'm huffing and puffing, and I'm saying, have mercy on the old man, you know. But it's a good program, and to move this body, it really matters.
Yeah, it does. Yeah, it does. I will let you know that I've been a fitness instructor for a while. One of your staff actually, she and I got into the fitness game right around the same time, and actually just celebrated my 61st birthday.
Wow.
And I'm still wearing them out. Thank you, Jesus. I'm still I got some people in my class like 29, 30 going, oh my goodness, what is wrong with you today? But you're right, movement is medicine. It really is. And stretching, I want to say that as well.
Man, let me tell you something about that.
Come on.
The Cavassier, what's it called?
Cavassier? No, Shavasana.
Oh, so Shavasana.
It's not Cavassier.
Okay.
That's a whole nother interview, bro.
Okay, my bad. Yeah. But that yoga, oh my goodness, yeah.
Yoga is important. Shavasana is important as well, because what Shavasana is, that's at 20 minutes after a yoga workout, where you just clear your mind. That's another big thing we got to deal with. You know what I'm saying?
Absolutely. And quite honestly, everything you described impacts our stress level. Movement has an impact on your stress level. It really does. And so to your point, as we look at those different programs, again, I said health is more than just going to see the doctor, and that's part of it. How do we manage our stress? And exercise programs, yoga programs, all of those are very good, and it has an impact on your mental health.
Yes, sir. Yes, sir.
And going back to the know your numbers, I mean, because that's how I got sucked in, right? You know, but that sounded, you know.
You got drawn in, so you can have a positive outcome.
Exactly.
Oh, but I got to work. You got to have breakfast. I got to work on you anyway. Go ahead, killer. Go and do your thing.
No, but that's how I got drawn into it. It's like I don't know anything.
Yeah.
You know, let's see. Let's see what it is, and man, it didn't cost anything, right. And then I was able to look and go, okay, well, this is where I stand. This is where blah blah blah, right. And you know, and that's how I got drawn in, and once again, here I am. So preventative is also cheaper, because if one of your concerns is, how am I gonna pay for this?
Yeah.
If that's one of your concerns is, I don't need these bills or whatever, right. Preventative is cheaper than post-ventative. I don't know what the word.
Absolutely. Pre and post, yeah.
Exactly. Thank you. Yeah. So just another angle. If finances is your concern, it's cheaper to do it before.
Right.
Yeah.
And like we talked about, finances, that's not an issue for us. You can have insurance. We'll certainly see you. You can have money. We'll take it. You can be broke, and you're still going to get the same service that everybody else gets. So that is not an issue to us.
I was just getting ready to ask you, because, I mean, the cost of living around here, the cost of oxygen is going up around here, okay? So, yeah, I think that's a great, wonderful thing to tell folks, because I think a lot of us wonder about whether or not we're going to have the money to do things. You know, do I have to have insurance?
Right.
How much is my visit going to cost, etc. You know, if you give somebody, you said something about a bus pass, Terrance. If you give somebody a bus pass, you get a bill for a bus pass later. You know, that kind of thing. I think people have a lot of concerns about that.
Right.
And once again, let me throw out the website, blackmenshealthclinic.org. That's the website you need to check out. You guys just won some really prestigious awards. Tell us about that.
Yes, we're very proud of our recent acknowledgement by the American Business Association out of New York. This organization periodically look at different organizations and look at what you're doing to see if it makes a difference. It's called the Stevie Award, and we were chosen under 2 categories. They had over 3,700 nominations that were submitted.
Right.
And these are top Fortune 500 major companies that you hear about. They're not even necessarily in healthcare. They're in other industries. But we received 2 awards. And the first award we received, it really tied to the fact that we are veteran owned. My son and I are both veterans, and so that qualified us to receive what's called the Silver Stevie Award, and that tied to our mandate of disrupting public health care.
Let's go.
And so we know that the healthcare system is complicated. It's difficult to maneuver. You can have insurance, and you might not be able to see a doctor for 3 months.
Wow.
So the healthcare system is very complicated, and we realize that in order for people to take full advantage, we have to what we call disrupt the typical system, and that's why the things we do are different, and that's why our approach is unique, and that's why it's successful. The second award was the Bronze Stevie Award, and that was because of the Thought Leader of the Year category. And so because of that, we were able to get that award. My son, Dr. Wallace, who leads day-to-day operations, he deserves a lot of credit for that. But those 2 awards meant a lot to us because we're just a little small nonprofit here in Austin, and to be recognized by folks in New York on a national level that look at what we do. Because sometimes, I got to be honest, I say, do we make a difference? You know, is what we doing bring value to the community? I do question that from time to time.
Really?
And yeah, I do, because you know, we run into issues where you lose funding because of what's coming, you know, out of Washington, and we struggle in those spaces. And so, honestly, I thought, are we making a difference? And so, this award said, yeah, you're making a difference, and guess what? You're doing something that's really outstanding, and you might not hear it locally, but we're here to tell you nationally, you have a model that deserves to be put in other communities.
Wow.
So this validates our work. It was like a shot in the arm, you know, and God knows what we need and when we need it, right?
Yes, sir.
And so to me, this was like, yeah, we got this. It's the right thing to do. So those awards were big time for us. Again, we got probably 17 people, small team, and we're knocking it out the park.
Man, you got a football team just in this room right now. And I'm so glad about that. I really, really am. I really am. And Terrance, Terry, I have just gained another level of respect for you, dude.
Oh, well, thank you.
Seriously, because you're putting yourself first. You know what I'm saying? Which you always kind of do, but in this case, you need to do. That's a whole nother.
Medically.
That's a whole nother interview entirely. Okay, real quick. Subscribe to the newsletter and follow Black Men's Health Clinic on social media. Right now, I'm actually looking at the website blackmenshealthclinic.org. Set an appointment. Share it with others. The motto is care you can trust. I love that. And also, you can make a donation as well, correct?
Absolutely.
Nice.
You can go to the website, and there's ways for you to support us. Again, as I said earlier, you know, we're just a small nonprofit. I appreciate the support that we get from Community Care,
Cool.
Who funds us, and we also have our partnership with Central Health.
Okay.
And so because of that, we're able to do what we do. We have a partnership with Integral Care, ECHO, Permanent Supportive Housing. All these are partners that are with us really to advance the work that we do.
And I just want to say, because this is important to me, that even though you say nonprofit, you know, that's not an indictment on the quality. That's not an indictment on the work that they do. They, you know, it's because some people think nonprofit and hear that. I mean, these guys, and once again, I'm telling you from experience. The follow up is amazing. Felicia be calling me. She won't leave me alone. You come into your appointment. I mean,
Right.
but stuff like that. If you have an appointment coming up, they will call you and text you and email you and call you and text you and email you, but they care.
Yeah, and another thing that's really important is our relationship with the federally qualified health center. And as I said, community care is an FQHC. And for them to partner with us, it's really critical because they have a mandate and a mission to take care of folks just like we do. And so it's a natural fit for us. They are our clinical partner, and we couldn't be more happy with what we have. And we're able to expand. We're now in Pflugerville.
Really?
Yep.
Wow.
Abundant Life Church. At their ministry, they have a program that serves the community, and so we have staff in Pflugerville that can do the same thing, and we connect with the community care clinic there in Pflugerville. We've been asked to bring this program to Fort Worth. We've been asked to bring it to Houston and a number of other places, but you know what? We need to do what we do right here at home first and meet the needs. So we're just really pleased with our progress over the first 5 years.
Amen to that. Now, real quick, I do want to let you guys know there is an upcoming event. It's a free event. It's a free exercise event. It's a Movement is Medicine class. Black Men's Health Clinic Movement is Medicine class. This Saturday, July the 11th at Mount Zion Church, 2938 East 13th Street between 9 and 10.
9 o'clock class and a 10 o'clock class.
Okay, all right. So I know some of y'all are early risers because I done started to get up at 7 o'clock in the morning wondering what I'm doing up now. So you got if I can get up, anybody can get up. You got no excuse. And also make a donation. You can make a donation as small as $5. It goes a long way for Black Men's Health Clinic. Anything before we let you go? Anything else that you'd like to get out there that we haven't touched on?
No, I just want to say to our brothers, if you wake up in the morning and you can't get out of bed, come see us. If you have constant headaches, come see us. If you have blurred vision, come see us. If you experience dizziness, come see us. All of these are indications of something that's going on. And to the fact that my brother just made, we can let things go and think it's going to get better. I liken health to men like a car. You can buy a car, it can be a brand new car. If you never get maintenance, if you never change the oil, if you don't ever check your transmission fluid, or if you don't ever rotate your tires, somewhere down the road, you're going to be sitting on the side of the road. This body is the same way. And so we need to take preventive maintenance on our bodies just like we do our cars. And you can have an old car and you say, wow, that car's still running. Why is that? It's because the oil was changed on a regular basis. It was maintained on a regular basis. And you can have a new car and in 2 or 3 years, it's junked. Why? Because you didn't take care of it.
Yes,
I look at the human body and what we do is the same way.
Amen to that.
Right.
Amen. Dr. Larry, thank you so much for being on. We certainly appreciate it. We probably have you on for another hour, man. We really could.
Well, we just appreciate the opportunity. We want to save lives, and as we lift up our brothers, we lift up their families.
Amen
and
to
so this work is really, really important to us, and we appreciate this opportunity. And I never knew that I had a bonus sitting next to me because he could have done the show. I told him earlier, everything I'm saying, he's already saying it.
Right.
And it makes a big difference when somebody else who has received the services, testimonies are huge.
Yep,
testimonies are huge. And I just so appreciate my brother being here on this morning with us.
Well, I appreciate being here with y'all. It was fortuitous.
Yes, sir. Yes, definitely good stuff. BlackMen'sHealthClinic.org. That is the website. Y'all, it's the morning grind.